Hi there, welcome back, Module 5. Those of you who've stuck with it, we're impressed, and you're going to be rewarded for your diligence here. This is our last module, Developing a Project or Proposal Part 2. As you know, I'm Liz Carlson.
And I'm Beth Staffolino.
So there's going to be 3 parts to this material. First, we're going to talk about procedures for collecting data. Secondly, we're going to talk about the IRB process. And third, about human protection when doing research. So factors to consider when planning for data collection. This is a review of some of the work that you've done before, that we've reviewed before, but it's important just to remember that you need to determine the kind of data that needs to be collected, when, how, who's going to collect it, and what types of methods or instruments are going to be used.
So you may be asking yourself, do you need to do a pilot or not? Sometimes a pilot study may be needed. This is, you may need to kind of scale back and look at a specific data collection method. You may want to test out a questionnaire and make sure everything runs smoothly. You may need to evaluate an instrument or a process to maybe hone out if there's any red flags or problems that may arise. Let's say if you need to target a specific population, you may just want to run through maybe even five subjects and make sure it goes smoothly. And then you may want to, it may be needed to confirm the study feasibility. If you're doing a survey with staff and asking sensitive questions, they may not want to do the survey. And this just, a pilot study allows for any revisions and fine-tuning. So concepts of measurement, this is just a very brief review. You may consider survey, observation, questionnaires. There may be biophysical measures, lab work that needs to be done. There could be interviews or standardized tests.
So there's this slide shows methods to collect quantitative data. Okay, and quantitative data is data that can be counted. So you'll see the data, you can see here from the data collection methods that these would provide that type of data.
Again, some of the issues with quantitative data, we talked about these a little bit in our previous module when we said that you really have to have a well-written plan that outlines the process for data collection. And you need to train the research assistants or data collectors to make sure that everyone is following the same procedure. We mentioned that in the last module too. And you may want to look at the inter-rater reliability. Is everyone collecting the same thing the same way? I think I had mentioned too, how are you going to be collecting data? Is it going to be electronically? Is it going to be handwritten? Do you have a specific data management book or a code book that may be needed? And again, what is the time frame? And how are you going to manage if studies drop out?
So this is another handy chart, and this looks at the qualitative data. These are different methods depending on what design you have, which is along the left, versus the data collection method on the right. And again, it just is a helpful way to for you to evaluate or to consider different methods or different ways to collect data. So one of the things in qualitative data collection, because qualitative data has to do with words, ideas, beliefs, concepts, not unlike quantitative data that has to do more with numbers and counting, there's a little different approach to establish the trustworthiness of a study. One of these various strategies listed here help establish the credibility of the data collector. So if you are not a member of the group that you're evaluating, what is it that you have to do to make sure that they understand that this study is a credible study? Confirmability, because it is, because qualitative studies are more conceptually based, looking at ideas, beliefs, thoughts, you need to have the ability to audit and to accurately confirm that what has been heard is really what has been told to you. Similarly, dependability. Those are confirmability and dependability go together. That shows that, yes, indeed, we all agree that this information is the information that was given and it is being evaluated or interpreted in a similar manner. And the last part is transferability. So that, again, is along the lines of generalizability. How is this data able to be transferred, the results from these studies able to be transferred? And these are some of the strategies used to ensure that it's transferable.
We are going to just spend a couple minutes on reliability and validity. I know that we have kind of touched on this in earlier modules, but you really want to be able to, the goal is to reduce measurement error. And, you know, is it random error or systematic error? Random error occurs, as the name implies, it's random. You know, a subject fills in the wrong bubble, and these are things that are difficult for researchers to sometimes control. A systematic error is something that is systematically wrong. That methodological, there is something wrong with the instrument or something else in the environment that is causing the error. And that it can be hard to control, but nonetheless it needs to be accounted for. And validity is really, you want to look at the degree to which the instrument is measuring what it's supposed to measure. For example, are you measuring fear or are you measuring anxiety? You're using a specific instrument, you need to make sure that it's measuring the variable that you want to look at. And content validity, face validity, really is allowing others, experts, to examine the instrument and look at the content to make sure that it is capturing the concept that it's supposed to. Criterion related validity, you can look at concurrent validity. Are you using two instruments simultaneously to hopefully look at the same outcome? Sometimes this is done when you have a typical or a gold standard and you may want to test out a new instrument to see if it's just as good. And then predictive validity is whether a current score on a test or survey is going to be correlated with something that is done in the future. So if you do a stress test today and take it again in 2 weeks, are the results going to be similar or correlate?
And then construct validity focuses on theories because a construct is theoretical, and it really looks at how well does the instrument test the theoretical concept. So this is like tools that were developed to measure depression. They have construct validity, and this is a whole process in and of itself. Dissertations are written on instrument development. People, researchers, spend their lifetime testing instruments to make sure that they actually focus and test the theoretical concept that they think of. So this is not something that you all would be involved in. I do want to mention that the second let me just go back one page here a minute. This criterion related validity, this, I think many of the things that you will be looking at instruments will have criterion related validity. Content validity, the first type that we talked about, is when you ask someone what is their opinion on this, and it's not considered as strong as criterion or construct validity. Reliability. Reliability has to be considered in relation to validity. An instrument can be reliable but may not be valid. So the best example I have is the bathroom scale, and it weighs you, measures you for weight. And if you get on and off it 10 times within the same period of time, it's going to be reliable if it comes within a pound or two of where it was before. But if you're anxious over weight, you cannot conclude that the scale is going to measure anxiety, even though it reliably measures weight. So you can have something that's reliable that measures the same thing over and over and over. But if it's not measuring the concept you think it's measuring, then it is not valid. So that's why when you talk about an instrument, you talk about having both reliability and validity.
Other aspects of reliability, when you're testing instruments, for reliability, you want to look at the stability. So is the same score obtained if you do repeated measures under the same condition? Going back to the weight issue, so is the measure of weight going to be similar every morning when you step on that same exact scale in the same spot in your bare feet? Probably not. That's going to depend on what you've eaten. Anyway, but I think you understand the point. And equivalence would be, is there going to be agreement between measuring blood pressure if one nurse does it versus another nurse is doing it? And internal consistency is really making sure that all the items are measuring the same concept.
So what is IRB? You hear the words IRB, or you hear IRB talked about a lot. IRB stands for the Investigational Review Board, and their responsibility, and they have federal mandates. They have to protect human subjects from harm that might result from research or study activities. And the rules that IRB uses and the criteria used to evaluate protecting human subjects are based on the ethical principles of non-malfeasance, beneficence, and justice. And I know all of you remember these rules from your days in philosophy, but just in case you don't, non-malfeasance means that you have an obligation not to inflict harm intentionally. Beneficence is you have a responsibility to prevent evil or harm, to remove evil or harm, or to do or promote good. And justice is fair, equitable, and appropriate treatment in terms of what is due or owed to persons.
So the IRB process may differ slightly from organization to organization. Here at Rush, we have a portal system, so everything now is done electronically, which is much easier to navigate than when we had to do things with paper copies. But there should be a component within the IRB that is just responsible, or a department that is responsible for human subject protection. And oftentimes you have to go through some training to make sure that you as the researcher or project director are doing things that are safe for the subject and you yourself. So training is required. We here at Rush go through an online training that's pretty convenient. It's called the CITI training. The committee, the IRB office in committee can offer guidance in terms of how you need to go through the process. And as I said, it does require some training. This is a time where, again, you may want to work with a mentor, someone who has done this process before. Tap into an advanced practice nurse or someone that is working with you that can help you navigate this process. But the IRB office should also be a resource for you that can help you. The CITI material includes information about human subject research, the HIPAA, clinical trials billing, and conflict of interest. This is just the website if you want to look at the training. There are some modules that you have to cover, and typically for nurses, when we do biopsychological research, there are probably 7 or 8 modules. You don't have to do, I think there's 15 modules in total. Don't quote me on that, but there's an area to click off what type of research you're doing, and usually it's about 8 modules, and they go quickly.
And here's the link for the RUSH training. You can go in through here, and it gives you the information that you need to do the IRB training.
This is also for the portal page. There is a half an hour, I believe it's half an hour in-person training just to learn how to navigate the portal. And again, the gentleman that does that here at Rush is very user-friendly. He's always pretty available to help. I've called him numerous times, and he's always at the other end.
Right, and if you contact the office of the research office here, they'll be able to put you through to the person that you need to talk to if you have a question.
So again, getting back to the process that I mentioned earlier, it's really helpful to first work with the staff in the IRB office because you want to make sure you have everything you need to complete the information on the application. You can submit questions electronically. You can call them. They are pretty prompt at getting back to you on your questions. But I would plan ahead, just navigating the process of uploading your application in the portal. Your first time may take a little bit longer than you anticipate, and then depending upon the type of study and or the review, we're going to talk about that in a moment, but it could take a couple weeks for you to get a response. So if you are on a very strict timeline and you need to do your project, please allow the lead time for getting your project reviewed at the IRB.
So do all of the studies that are done need to go through human subjects review? Of course, the answer depends on the type of study and the data being collected. And it also depends on how the results are going to be used and disseminated. If it's a research study, it requires review. Quality improvement studies commonly do not require review unless you're planning to publish the results. And frequently, the type of review for a quality improvement study is of a shorter duration than that of a research study.
So some of the things that you do need to address and think about in terms of just ethical considerations are, your sampling. And this is what the review committee and the IRB will look at is, are you being ethical in terms of your sample? Are you using a a vulnerable population, which is listed the third bullet point. Are you including men and women? If you include children, there's kind of another guideline that you need to go through. But
if you look back at the slides a little bit earlier that we talked about, that we went through kind of quickly about these different principles, justice, malfeasance, and beneficence, it helped me anyway understand why they ask some of these questions that sometimes when you're answering them, I just think, what? Why are we answering that? But it's because of these ethical principles upon which the IRB and the human subject review are based.
And then confidentiality, there's going to be an area in the application that the review committee is going to want to ensure that your data collection methods, that information is going to be held confidential. Where are you storing the data? Is the data going to have identifiers on it? Things like that. So you'll have to address questions like that. And then certainly, depending upon the type of study, and if you do need it to get informed consent, if you're doing questionnaires, surveys, if you're doing any kind of biophysical measures, you will most likely need informed consent, and you'll need to have that included as well. And then you also lastly, you need to address the benefit and risk to participate. Does the benefit of participating outweigh any risk? Is it a minimal risk to the individual? Okay, so types of reviews. A full panel review is necessary when your study poses anything greater than minimal risk to the individual. If you are doing blood draws, if you are doing any kind of testing where the individual could be at risk for harm, then a full review is needed. An expedited review would be anything that is minimal risk. If you're just doing a survey of patients who are, a quality of life survey, that would go through expedited review. It may be minimal risk. And then something that would be considered exempt would be, let's say you're providing an education to staff and you just want to collect some follow-up data. Did they gain knowledge? And that would probably be information that would not be identified. There's very little risk. And that would be an exempt review. HIPAA, you're probably all familiar with, and when you do get informed consent, now a HIPAA form is also required along with that informed consent, so that anytime data is accessed or gathered from the patient's record, HIPAA is also required. There is, in some instances, where you can ask for a waiver of authorization, and there may be a case where HIPAA does not apply.
And an example of that is if you are directly asking the patient some information, the patient can either decide to give it to you or not. The issue with collecting it from a patient record is that if it's there, they need to protect the patient and make sure that it's being used appropriately. And if you both ask the patient and access their record, then HIPAA does apply. The reason to be aware of this is because sometimes you don't need to access the patient's record and can directly get the information from the patient, and that certainly reduces the amount of review that is required and the level of consent that is required. So it's just something to consider, because sometimes you can structure your questions in such a manner as to not require HIPAA authorization as well. So congratulations. You've got the knowledge to begin using research for evidence-based practice. You're able to address problems you experience in practice using the knowledge and tools presented. And now your task is to use this knowledge and skill and improve the care your patients receive. And of course, as we've been saying, publish the results so that all will benefit. Thank you for being with us. We have enjoyed presenting these modules, and we hope that you've gained the knowledge that you were seeking.
Thank you.
Bye.